So welcome everyone today to this evening on zinc and immunity. So as you know, COVID pandemic is across the globe and India is nowhere far away from it, and we have been suffering with COVID pandemic. And just a couple of days back, ICMR has released its new statement, which it said that in May we were having approximately 80 lakh infected cases, whereas the documented cases even today is around 40 lakhs. So the number of infected cases might be much larger than what we are seeing, those who are diagnosed and those who are detected. The Seropub study that was done by ICMR says that in May itself, which is around 3 months down the line, we had approximately around 80 lakhs. So today, I guess we would be in crores that people who are already infected and exposed to this deadly virus pandemic. And as even time and time it has been said that the best way to protect ourselves from this pandemic would be to build our internal immunity and build our reserves for to fight with the infection. So first is we protect ourselves from the infection, and in case we get the infected, so we develop the immunity so that the body is so well protected that even that infection we can fight it out and come out as a winner. So for this, we have Dr. Papa Rao with us. Sir is a consultant physician at KIMS Hospital, Hyderabad. Sir has got a vast experience in terms of internal medicine, critical care. So today we'll see his expertise even from not only from as a physician but also from a person from a critical care perspective. Because what we are afraid today is once we get the coronavirus, if it is a mild case, we do not mind it because it just comes and goes off. But once you end up in a critical care situation, so there what are the challenges and what is the role of zinc in particular in prevention of coronavirus as well as in the treatment of coronavirus. So with this, I hand over the session to sir. Sir, the dice is all yours now.
Thank you. I am putting the share screen.
Yes, sir.
Sharing the screen. Are you able to see my screen?
Not yet, sir.
Yeah. How is it now?
No, so still we are unable to see the screen. The screen has not been shared yet.
Screen sharing.
At the bottom, you will see a green screen sharing arrow. That
Yeah. Screen share. Now?
yet to come, sir. Yes, sir, it has come.
It has come now. New share, shall I have to?
You need to put it in a slide mode.
Yeah. Is that okay now?
Yes, sir, absolutely fine.
Yeah. Am I audible and audible and visible?
Yes, sir.
So there are just few people. around 7 participants. I
The
will
participant would
take
not be
just
participant would not be visible here. The participants are much higher because
the,
they would be in a different link.
okay. There are about 7 participants still. Yeah, I'll start. Okay. So thank you, Dr. Manish. Thank you, Ritu. Thank you, all the organizers to make this possible. Thank you, mankind. In the next maybe 20-25 minutes, I'm going to talk on various micro elements, micronutrients related to immunity. Yeah. See, the micronutrient content in our foods has decreased to a great extent. This is an ICMR and National Institute of Nutrition (NIN) study. And you see the contents of various foods, see, which used to be just a decade, 2 decades ago. The iron content in a tomato used to be 100%, has reduced to 35%. Similarly, thiamine to 20%, magnesium to 21%, and so on. So what this means is we are in the race to produce uh, agricultural products. We are in the race to produce more and more production, and in the process of producing more produce like more food in products, we are compromising the what we are increasing is the carbohydrate part of the each fruit or each vegetable, and thus the micronutrient and real nutritional value is going down. So look at this prevalence of deficiency of individual vitamins and minerals. Zinc is the prevalence of deficiency is 67.5. It is just after vitamin D. So high the prevalence. This is an Indian study in 2013 showing that zinc has, serum zinc levels ideally should be less. We should be 100 micrograms per deciliter. Anything less than 70 is defined as as a biomarker for zinc deficiency. So you can say there is a lot of prevalence of zinc deficiency like other also. So essential micronutrients, role of zinc over 300 metalloenzymes, the my presentation is coming in the way. Okay. So yeah. So India, with its population of 1.3 billion, ranked number 2 in the world for the number of children suffering from malnutrition and 15th among the leading countries with hunger situation. The hunger is not the real hunger. There can be a hidden hunger as well. When there is micronutrient deficiency, vitamin deficiency, other deficiencies, the guy may be, fat, the guy may be fully overweight also sometimes, but there will be hidden hunger for these micronutrients. Look at the deaths due to zinc deficiency all over the world. India stands first. There are about 25,000 deaths per year, about 15% of the deaths goes because of the zinc deficiency from India. So about 15.65%. What are the signs not getting enough zinc? There could be many signs. If you understand, loss of, right from loss of appetite, hormonal imbalance, hair loss, brain fog, weak immune system, changes in smell, low libido, poor wound healing, unexplained weight loss, digestive issues, developmental delays, diarrhea, changes in taste, fatigue, etc. As the zinc deficiency continues, the symptoms continues to be progressive. So micronutrient deficiency is further precipitated in patients taking chronic medications. We'll just give one example. Zinc deficiency by prolonged hydrochlorothiazide. Hydrochlorothiazide is a diuretic. We commonly use, as a chlorothiazide drug. And thiazide diuretics have been reported to increase the urinary zinc excretion and to induce a zinc deficiency. So it's very clear. And zinc transporters and insulin resistance, therapeutic implications for type 2 diabetes and metabolic diseases. You see, the zinc has a major transporter. Zinc derived play a major role in regulating the cytosolic zinc homeostasis and insulin production at the beta cell level. So, a zinc deficiency can hamper the process of insulin secretion from beta cells and worsening the disease state and thus increasing the complications as well. So, zinc deficiency can directly or indirectly lead to insulin resistance as well as relative insulin deficiency and also absolute insulin deficiency according to the situation. So micronutrients and minerals play a very important role in strengthening our immune system, of which zinc plays even very important and pivotal role. How do micronutrients affect the immune system? You see, the epithelial barriers, vitamin A, E, C, and zinc, you know, the sites of these are the various sites of micronutrients which can hamper, which can affect the immune system. One is epithelial barriers like zinc. Second is cellular immunity, again with various other vitamins, zinc, copper, selenium, iron, etc. And the antibody production, zinc is also an important component in the antibody production. So and thus affects an individual micronutrient status to their immune status. So we all know that there is normal immune system is innate immunity and adaptive immunity, and zinc deficient immune system mainly works on both innate as well as adaptive. Innate immunity by interfering with the various I will not go into the very details, minute details. So basically in innate immunity, it increases the production of uh, interferons, which are antiviral drugs, and also it can have a at the cellular level. It doesn't allow the by improving the immunity or strengthening the cell wall of the human being, and it doesn't allow the virus to get into the intracellularly. That's number one. Number two, in the adaptive stage, it also increases the antibody production, and thus zinc affects the immune system. So zinc controls various important steps in maintaining and strengthening the immune system of the body. Look at the immune role, various immunity roles, micronutrients and immune system working in harmony, structural and functional integrity of mucosal cells in innate barriers. Mucosal barrier is one very important barrier, and it is the biggest barrier for the virus as well as bacteria and so on, particularly the viral illness. So zinc is an important factor here, micronutrient involved. Zinc, folate, and iron as well, and various other vitamins. So proliferation, functioning, and movement of innate immune system, again zinc. Differentiation, proliferation, and normal functioning of T cells, again zinc, iron, copper, etc. Antioxidant effect, again zinc, copper, magnesium, etc. Antimicrobial effect, zinc, iron, copper, selenium. Response to antigens, again folate, zinc, magnesium. And antibody production and development, again folate, zinc, magnesium, selenium, etc. So zinc is as a part of micronutrient that is involved in every immune role in the human system. What are the various dietary sources? Oysters, meats, nuts, shellfish, poultry. Mainly oysters, meat and nuts and shellfish are most important source. We know that how many of us take oysters and meat and sufficient to the human body. And cereals, breads, fish, green vegetables, potatoes, fresh fruits, they also contain small amounts of zinc as well. So these are the major dietary sources. So zinc metabolism, if you look at Body content of total content of zinc is 2 grams, and serum zinc levels is 100 micrograms per deciliter. So zinc is the highest content in duodenum and jejunum, and every organ of the body is abundant with zinc. So recommended daily allowances, it is in the small children 2 to 3 milligrams. When it comes to adolescents and 9 to 13 years 8 milligrams, and adolescents 14 to 19 years 11 milligrams, and in pregnant woman 12 milligrams, lactating woman 12 or 13 milligrams. So these are the daily recommended daily allowance of the zinc. So the diverse stages of the stages of viral replication cycles that are inhibited by the zinc in vitro. Inhibition of the viral uncoating means it viral genome transcription and viral protein translation and polyprotein processing. These are all the various theoretical processes. However, what happens exactly at the cell level is it strengthens the cell membrane and thus doesn't allow the virus to go inside, number one. Number two, it affects on the viral genome transcription and can destroy the virus. Number three, viral protein translation and polyprotein processing is affected when it crosses the cell level, it goes to the intracellular level. So before it goes and attaches to the cell membrane, it has a role. And on the cell membrane, zinc has a role. Even when the organism goes intracellular, it still has a role and can affect the viral replication directly or indirectly. So when it comes to the present pandemic, COVID-19, in vitro studies suggest that free zinc possess potent antiviral effects and are supported by trials. So zinc treatment of these are in vitro trials. There are no real, no in vivo or human trials. I think there are many studies going on at this point. We are waiting for the reports. Similarly, other drugs which are earlier thought of in vitro antiviral are still, particularly HCQS, which now has don't have a role, and so on. So zinc treatment applied at a therapeutic dose has the potential to drastically improve the clearance of both chronic and acute viral illnesses. We know how the zinc is affecting in the human body by objecting or by controlling at every point after viral entry to producing antibody as well. So zinc supplementation implemented to improve the antiviral response and systemic immunity in patients with zinc deficiency. So this is more important in patients with zinc deficiency. But we have seen almost 67% of Indian children are zinc deficient, and zinc treatment performed to specifically inhibit the viral replication and the production of viral antibodies. So in vitro experimental demonstrates that zinc possesses antiviral activity through inhibition of SARS-CoV RNA polymerase. That's what we have seen, the viral replication, viral genomic transcriptase. And zinc may decrease the activity of angiotensin converting enzyme 2, known to be the receptor for the SARS-CoV-2. So wherever the ACE2 receptors are there, particularly in the respiratory tract and in the gut, the viral entry is easy. So there are what happens with the zinc is zinc will decrease the activity of ACE enzyme 2 at the level of entry, so that the entry into the intracellular entry is prevented through. So upregulation of interferon alpha production and increasing its antiviral activity. Interferon alpha is the basic innate immunity. This is the primary immunity against any viral disease is interferons. So therefore, zinc possesses protective effect as preventive and adjuvant therapy of COVID-19 through reducing inflammation, improvement of mucociliary clearance, prevention of ventilator-associated lung injury, and modulation of antiviral and antibacterial effects. So zinc should be considered as an add-on to the treatment therapy of COVID-19 infection. It has shown significant impact on viral infections other than even COVID, many of the viral infections. This improves the innate immunity, like basic, the primary immunity of a human being is the innate immunity. And as we know, it also improves the adaptive immunity by increasing the production of antibodies. So zinc has shown significant impact on viral infections. Zinc deficiency can be considered as the potential risk factor for invasion of the virus through the respiratory tract, as well as producing pneumonia, as well as through the GI tract producing diarrhea and so on. This is a complex, a very busy picture showing that viral mechanism of COVID and how they might be opposed by the zinc. It opposes at 3-4 levels. We have seen that it improves the primary immunity or innate immunity, and it resists the virus as well. It has some antiviral properties. It affects on the RNA of the virus and thus destroys the virus. It strengthens the cell membrane and doesn't allow the virus to enter into the cell. Even if it enters into the cell, it has antiviral properties. This is the big picture and mechanism how the zinc acts against COVID-19. So we'll just see to understand a simple case study. A 41-year-old female health worker developed influenza-like illness with the sinus pain on day 1, and then on day 3 she has fever and tested positive for COVID. On the day 4, her PO2 started dropping. On day 6, she developed shortness of breath with PaO2 less than 94 and was started on whatever the various possible therapies. And then on the evening of the day 9, she started on zinc 23 mg every 4 hourly, 138 mg per day. See what happens. Once the zinc is started, you can see here, once the zinc is started, now her PaO2 started improving, and her effect on the fever also, as the zinc is started here and slowly, gradually, it has affected and reduced the fever. This is the direct effect of the zinc on saturation as well as on temperature. So on day 10, she felt better. Her PaO2 and fever began improving 1 day after zinc was initiated, and she continued to take zinc in the recommended doses and was well by day 19. So what should be the dosage in COVID patients? With the multiple doses approved for zinc, zinc is essential for even non-COVID patients. Zinc is essential for a normal person, because we have to be ready at any time. Something like COVID can attack, or there are many other viruses to attack us. They are lurking behind, and there are so many kinds of varieties of virus, including H1N1, SARS virus, Zika virus, and so on. So zinc by 50 mg per day for 3 months in order to strengthen the immune system to prevent the serious effects of COVID-19. This is the standard recommended dose, 50 milligrams per day. And a caution about excessively taking zinc. Symptoms usually do not become evident until ingestion exceeds 1 to 2 grams of zinc. So toxic exposure have occurred through the gastrointestinal, dermal, respiratory, and parental routes. Inhalational toxicity also. During Diwali, we see there are smoke bombs containing zinc chloride, which can cause chest pain, airway irritation, acute respiratory distress syndrome, and pulmonary fibrosis as well. On the other hand, the inhalation of zinc oxide can lead to an entity known as metal fume fever, which usually occurs secondary to occupational exposure. So zinc excess can affect brain, respiratory tract, gastrointestinal tract, prostate, and various systemic symptoms. So the treatment of zinc excess is, control the zinc. Secondary to oral, primary treatment of acute toxicity secondary to oral ingestion is supportive. Antiemetics and fluids should be given, as well as PPIs. PPIs reduces the pH and thus, it maintains the pH and reduces the acid production and thus have a control over the absorption, gastric absorption of the zinc, minimizing the digestion of zinc containing foreign bodies. So finally, chronic zinc toxicity is primarily treated with chelating agents like copper and calcium. Through severe cases may require chelation, but usually it's very, very rare phenomena. Though, this is the time we should keep a caution of zinc toxicity as well. There are the various non-immune benefits of the zinc. You can see it boosts libido, helps with acne, helps with eczema, helps in treating anorexia nervosa, helps with adolescent growth, heals wounds, of course, immune booster, maintains sense of taste and smell, protects membrane cells against the free radicals, helps with macular degeneration, regulates blood glucose, supports neurological function, supports normal growth and during pregnancy as well. So it has multiple pleiotropic benefits, not only just immune system. So in summary, ladies and gentlemen, zinc is a very essential micronutrient which helps in multiple functions of the human body. It has a pivotal role in maintenance of immune system and also has direct action on the viral structure as well as its viral replication, and as well as zinc improves the antibody production and thus improves the innate as well as uh, adaptive immunity. Supplementation of zinc should be considered along with food to maintain the daily requirement of body. Zinc at a dose of 50 mg has shown promising results in patients with COVID-19, and zinc should be considered as add-on therapy. Don't think zinc will do everything. It has associated benefits when your primary treatment has to go. Along with that, this is supporting, So zinc should be considered as add-on therapy in COVID patients as well as in normal people, not to go for a zinc deficiency so that their innate immune levels are much, much higher so that the disease combating capacity is higher. Thank you very much, ladies and gentlemen, for your patient listening. Dr. Manish.
Thank you, sir, for wonderful talk. Uh, Now, there are a few questions which have come in.
Yeah, please go ahead.
Yes. So the first question that is coming is what should be the appropriate dose for immunity booster as well as for the treatment? Is there a difference between the two dosing pattern?
Yeah, excellent. Once you start the dose of 50 milligrams per day, now in a case of COVID, when we know that immune boosting is required, we can give even 4th hourly till we reach, the symptoms are benefited. At least first 10 days we can give 4th hourly, and thereafter 50 milligrams, one tablet for at least 3 months. This is once somebody gets COVID. But pre-COVID, to improve the innate immunity, we can keep taking as a supplement in a multivitamin or separately, 50 milligrams once daily, at least 3 to 6 months.
Sir, in your clinical practice, like KIMS must be having a COVID center, right?
Yes.
So, what is the protocol like? What is the treatment protocol that you people are adopting to, and what is the dosing of the zinc that you are giving, and what is the duration of zinc that you are giving?
We are usually starting 50 milligrams 2 times a day. Once somebody, suspected to have COVID, and we are asking them to continue till complete, twice daily till the symptoms and improvement has happened. After that, once daily at least for 3 months.
Okay, sir. And sir, is there any toxicity that you see among patients who are on
No,
zinc,
no,
or
no, never,
it is well
never.
tolerated?
It is not easy to get zinc toxicity unless they take, grams and grams of zinc. Normally, in usual terms, uh, most of the people, 67-70% of Indian population are zinc deficient. With that, we can estimate how much zinc is missing in the micronutrients of our regular diet. So almost many people have zinc deficiency. So going to a zinc toxicity is something very, very rare phenomena. Rather, we can say it is theoretical phenomena. Like, we have seen vitamin D deficiencies. Many people are taking weekly for a very long time, 3 months, 4 months. Rarely they are going into vitamin D hypervitaminosis, though there is a caution. This is just a clinical phenomena. So whenever the vitamin D is high, we ask them to stop, and in a few weeks it comes back to normal. Similarly, after giving zinc for 3 months, we can give a we can give a we can stop for 3 months, and then at least give them 10 days in a month will maintain the whatever the zinc deficiency. So 50 mg 2 times is a therapeutic dose, and 50 mg once daily is a maintenance dose over a period of time without any possibility of zinc toxicity.
Sir, so post-COVID patient, how long? Do you prescribe for 3 months, or it is for a shorter duration, or it is a longer duration? Those patient who has already recovered from COVID.
Once they are recovered from COVID, we are giving a daily requirement for at least 3 months.
At least 3 months. And so we have some other questions also coming in.
Yeah.
So in patients who have CKD, or the patients who have renal compromise, because zinc being a metal, how safe is it, and is there any concern in these patients? Do we need to take some precautions?
No, zinc is not a nephrotoxic by itself, and zinc can benefit even in patients with uh, glomerular membrane disorders, certain specific kidney disorders, not specifically acute AKI also, but in some of the immune mediated disorders of the kidney should also benefit from, supplementation of zinc. But zinc is not is a metal, but zinc is not a nephrotoxic agent by itself.
So it can be safely given to those
We
patients who
can be
are.
say we have seen the effects of toxicity of the zinc in one of the slides, where it can affect brain to every part when it is too much, but it rarely affects the kidney. And normally, if you restrict to 3 months and give a daily recommended daily daily requirement of at least something like 50 milligrams, how much it is absorbed we are not sure. So take a gaps in between, and at least in COVID patients, or when somebody in this, how much is the in vivo, we don't know. There are no control trials yet. They are coming up. So this is all theoretical possibilities that it can have all the effects on any virus, including COVID. So we should effectively maintain the zinc levels in the body, so that the overall innate as well as adaptive, even post-COVID status, we want antibody titers to go up. So this is the time where we have to still supplementing zinc over a period of time, at
So,
least for 3 months.
so how would you rate some of the supplement? They come with a 5 milligram, 10 milligram, 20 milligram. Some of them have
No,
even as high as 50 and 75 milligram. So
they
which is the
are
most?
just part of multivitamins. They just provide very small dose, which may not be sufficient. So we have to give a sufficient dose of at least 50 milligrams during, at least post-COVID state. Okay. 5 and 10 milligrams will not be sufficient, because already there is deficit. And the immune, you have to boost up the immune system as well as many other systems, where zinc is important part of that.
So we have a question which says that in cities like such as Bangalore and Ooty, where you have the climate conditions are quite cold, where the chances of getting a flu or cold is very high.
Yeah.
What is the best options to build a good immune system and stay protected from COVID?
It is not just the zinc. You have to have an overall approach towards preventing. There are so many preventing parameters, preventive measures that is required, right from social distance to mask. And there is a virus in front of you. Try to avoid that. Either you go away or the virus go away. Till that time, you have to take care of all the barrier measures like social distancing, mask, and hand sanitization. Otherwise, from inside, you have to boost up your immune system. Any nutritional deficiencies, anemias should be corrected. Similarly, if diabetes, if it is uncontrolled, that should be corrected. Hypertension, any heart disease, they have to be uh, controlled. They have to take care of the heart failure or anything like that. So overall, basics is, if you boost up the basic immunity status, then possibly you can combat it better. Even if somebody gets corona, most of the times we see 80 to 90% it is the only mild form. Only 5 to 10% reach the severe form, moderate to severe form. So boosting up, whatever the measures, boosting up all these will boost up the immune system, will boost up the innate or primary immune level, so that we can combat the viral infections effectively.
Sir, here the question is, does zinc have some antiviral effect, or it is only affecting through building immunity?
I have shown that it has shown that why the point of zinc started after COVID, because in vitro studies in the test tube, it has shown that adding zinc has effectively reduces the viral load in vitro. Now in vivo trials are going on. So how it reduces the viral load in vitro is that it effectively affects the RNA, the genome of the virus, and it has a uncoating of the virus, so that it cannot allow the virus to enter. Even before entering, the virus can be destroyed. These are the various possible theories that effectively kills the virus in vitro. We have to see in an environment of in vivo how effective is zinc to facilitate further studies.
Uh, Sir, apart from zinc, when we talk about post-COVID patients where zinc plays a vital role in rebuilding the immune system and the overall body muscle strength, for the post-COVID fatigue, which mostly patients come with, they have weakness, they have a lot of fatigue. So, is there any role of L-carnitine and or other supplements in this post-COVID fatigue?
At this point, we do not know. We are normally advising to take adequate diet and high protein diet, so that the protein is essential for promoting antibody production. And a multivitamin which contains all vitamins, all micronutrients, and so on. So supplementation of these is useful, and it takes its own time. Why the generalized weakness persists for long time is not still yet clear, whether it is directly effect on the muscles or anything. But most of the studies, the way even the pains are very severe, the CPK and LDH enzymes are not raised post COVID state. So precisely the answer is not known, and possibly taking all the adequate nutritional measures and supplementing the micronutrients uh, could be one option.
Sir, why is India so deficit in zinc? Though we are a vegetarian country, our diet is, even in the elite class, you find a lot of zinc deficiency.
Yeah. So in vegetarian as well as non-vegetarian diets, definitely about uh, even in the daily requirement there is deficit to the tune of 30 to 40%. even with the regular foods, both in vegetarians as well as non-vegetarians. You see that there most of them oysters, poultry, meat, milk. These are all non-vegetarian diets where vegans will definitely suffer from zinc deficit, and supplementing micronutrients is a wise option, and also focusing on the diet which is zinc rich, like we don't eat much of oysters here, but whatever the other cereals, the potatoes, and whatever the other foods that fresh fruits and vegetables. So these are all has micronutritive level, micro levels of zinc. Now focusing on zinc rich foods like these could be of helpful, but may not be sufficient also because of our dietary habits and so on. So we tend to eat more of carbohydrate diet, which is clearly zinc deficient. So it's wise to supplement zinc, in a regular patient with who has symptoms or no symptoms, to potentiate their immune as well as other systems.
So you spoke about zinc and diabetes, role of
Yes.
zinc in diabetes. So how effective is, or what is the important in zinc in management of diabetes?
Yeah, it's well known. Copper, zinc, selenium, these are the basic elements. They have a sensitivity over the beta cells, and deficiency of any of these will have a at the level of the beta cell. These are all essential for the production of insulin. So the production of insulin is reduced if any of these are deficient. Number one. Number two, it can also increases the insulin resistance. Even though there is insulin, if the deficit is there at the cell level, because the glucose requires insulin for the production of energy. So at the cell level also, if zinc, uh, selenium, and copper, if these are deficient, they can have absolute insulin deficiency as well as relative insulin deficiency. There is a direct relation. That's why we invariably make sure that these are supplemented to all the diabetic patients.
So in diabetes also you recommend a high dose of 50 mg, or it is a much lesser dose in diabetes patients?
It is, when we are treating a deficiency state in a therapeutic levels, then we give 50 mg. Otherwise, we keep giving intermittently, at least 10 days in a month of 50 mg will do. We'll
Okay.
at least avoid the deficiencies. That's
So
what I do in my practice.
okay, sir. That's so. So, sir, as you said that 50 mg of BD in COVID patients who are COVID positive, followed by 50 mg OD dose for the next 3 months
Yeah.
is what is recommended. And for and those for prophylactic, I think. How long should be taking, because we don't know how long this pandemic is going to last. So suppose I start from today, I don't know how long should I be taking.
Mhm. Don't take excessively. Once you start taking 50 mg a day, at least 3 months, thereafter keep taking 15 to 20 days a month. You give a holiday, a week holiday, something like that. At least take 3 weeks and take 2 weeks, 15 days in a month. So you give holiday first week and third week. You can take second week and fourth week. It is something like that. There is no definitive recommendations. This is what I do.
Sure, sir. Thank you, sir. Thank you for sharing your valuable inputs and your insights. I think people would have definitely benefited a lot, because there's a lot of confusion about when you talk about zinc, because vitamin D, people understand that 60K has to be taken every week because we are all deficit in it. Zinc is something that we still do not understand the value of
No, there is
micronutrients.
also a duration for even vitamin D. If you take vitamin D more than 8 weeks or 12 weeks, it can go to the nowadays people are behind vitamin D and they are taking excessively, and people are now coming with vitamin D toxicity. So we have to balance everything at some point of time.
Yes, sir. And what about vitamin C that is there? What is the dose and what is the role of vitamin C in prevention as
Vitamin
well as?
C in general has you know presumed to have antiviral activity in the past. Now there are no definitive studies. Previously, when we started our practice 2.5 decades ago, for every viral illness, we used to give vitamin C. Later, there are many trials which has come that there is no direct effect with the disease and cause, with disease and vitamin C. So we are not that actively practicing, but vitamin C is also an essential part. Ideally, vitamin C should be supplemented with food, because this is a water soluble vitamin, so it is should be supplemented on daily basis. When a situation like this comes, we just need to be more cautious to take excess vitamin C, so that there is no vitamin C deficiency at the cell level. Otherwise, the clear effects of vitamin C in combating COVID or any other virus is not very clear. So only thing is we need to maintain lack of the vitamin C deficiency. Vitamin C deficiency should not be there. That is only our aim. If we take about 100 to 125 milligrams of vitamin C through the regular diet, that should be mostly enough. Otherwise, in clinical terms, you can take 500 milligrams 2 times chewable. Because it is water soluble, there is no toxicity to vitamin C.
Uh, what would be the vitamin zinc dosing for geriatric population? Do they need a higher dose, lower dose?
This is another vulnerable population actually, who frequently suffer from upper respiratory infections as well as pneumonias. So, and most of the elderly population, they are nutritional, particularly micronutrient deficit. So I strongly advise to take at least 50 milligrams of ginkgo life or zinc at least 3 to 6 months in a year. That means spread over a period, at least 2 weeks in every month. First 15 days of the month, keep taking alternate days. Definitely this maintains the zinc levels with the protectable and effective range. Effective range of 100 micrograms per percent per 100 ml. So this is the maintaining level. We are not routinely practicing estimating the zinc levels, but some laboratories are practicing, and some they are mainly in the experimental models only still yet. But things may come slowly, that if we can estimate the zinc levels and keep adjusting the doses, it would be of much benefit, because importance of zinc is increasing nowadays, and the importance of zinc in terms of immune booster, in terms of multiple activities, as well as prostate problems, libido issues, and cognitive functions. Zinc is coming up in a big way. So if we can get a zinc estimations level of serum levels of zinc, that would be of more directive, and precisely we can treat such patients. Now, I am recommending at least 15 days in a month, so that it will become 6 months in a year. This is at a therapeutic dose, so that the normal doses of 100 micrograms per cent is maintained.
So, what would be the duration and dosing of zinc in a Wilson's disease if we have to use it?
I'm not sure. I'm not an expert in Wilson's disease, and there are copper chelating agents are used. I don't know the relative efficacy of zinc. There we see more of D-penicillamine and so on.
So with this, sir, we have come to the end, and we have taken all the questions that were asked in the group. And on behalf of Mankind Pharma, I thank you for taking out your valuable time. I thank all our participants for taking out their valuable time and joining us in this session on zinc and immunity, and hope this would have benefited them and cleared their doubts about what are the dosing, what is the utility, and how long can we take zinc. With this, I once again thank everybody, and thank you, sir, for your wonderful presentation and sharing your clinical insight, because when you share your own clinical insight, people learn more from that rather than from the presentation that has been said. So thank you so once again, and
thank you very much. Thank you, Mankind. Thank you, Dr. Manish Chaudhary. Thank you, Ritu. And thank you all others for making this possible. Thank you very much.